We often get asked what is the difference between physiotherapy and exercise physiology. So we've created this short video to explain some of the differences. So in general, physiotherapists work with injuries and conditions throughout all phases of rehabilitation. Importantly, physiotherapists have training in providing hands-on therapy, which is very important in the early stages of some injuries, particularly when helping to reduce pain. On the other hand, exercise physiologists tend to work with individuals where only exercise based interventions, such as is the case in most lifestyle diseases, are required. These lifestyle diseases may include things such as weight control and diabetes. The easiest way to explain further is to take the example of an individual who injured themselves in an accident and was taken to hospital. After they receive the appropriate medical care and are allowed to get out of bed, a physiotherapist will initially assist them to get out of bed. They will then go home and continue to attend their physiotherapy appointments. The physiotherapist will assist them in getting back to their goals, such as playing sport. Once the individual has progressed through their rehabilitation and is completing exercise based interventions only, there is potential for the physiotherapist to involve an exercise physiologist at that point in time. It is important to note that at that point, the physiotherapist or the exercise physiologist can continue the individual's progressions in assisting them back to their goals. Now, in general, in the disability sector and with NDIS participants, whilst it's not always the case, most of the participants who see a physiotherapist or an exercise physiologist generally require exercise based interventions. So, does this mean both a physiotherapist and an exercise physiologist can see participants? Not quite. And in this next scene, we will tell you why. So, the reason that a physiotherapist or an exercise physiologist cannot see any participant who is referred is related to two things. One, the practitioner's skill set, and two, the practitioner's experience. As many of the participants on the NDIS often have complex disabilities, a specific level of knowledge is required to ensure that individual can receive the most effective form of therapy. Let's take another example in the next scene. An individual has recently had a fall and had a traumatic brain injury as well as other injuries as a result of the fall. After the hospital stay, the participant has now returned home and requires rehabilitation. In this case, a physiotherapist will be required to complete not only a neurological assessment, but also an orthopedic assessment. In addition, the physiotherapist may also prescribe certain assistive technologies such as walking aids, which may be important to help the participant get back to mobilizing. Now, after 3 months of physiotherapy interventions, the participant is now completing relatively routine exercises, which may require progression from week to week. It is at this stage that a physiotherapist may introduce an exercise physiologist to complete some of the exercise based interventions. So, in summary, both physiotherapists and exercise physiologists prescribe exercises. However, physiotherapists are generally more involved in the early stages of an injury or rehabilitation process. Both physiotherapists or exercise physiologists are able to provide progressions to exercises in the later stages of a rehabilitation process. However, it is important that the practitioners who are providing the therapy have the right skill set and experience. Whilst physiotherapists and exercise physiologists can both provide exercises to individuals with lifestyle diseases such as obesity and diabetes, it is generally exercise physiologists who provide these interventions more routinely.